Good afternoon, North Dakota. Welcome and appreciate your being here today. Thank you for investing your time to make sure that you're staying close to the facts and staying close to your family and your community and helping guide North Dakota through this ongoing situation. Today, additional speakers today are going to include Commerce Commissioner Michelle Kommer. Thank you, Michelle, for being here for an update on the ERG Economic Resiliency Grant Program. Before we kick into the numbers, thought we just level set. It's really easy sometimes to get caught up in whatever the most recent data might be, but I want to make sure that we're focusing on what we've been focusing on in terms of our strategic goals since the very beginning. First of all, number one, protect the most vulnerable among us. COVID-19 is a disease that is deadly for people that are elderly and have underlying health conditions, and we've been very focused on that ever since we've launched our VP3, or the Vulnerable Population Protection Plan. We've been a national leader in the regard of protecting those most vulnerably, and one measure of that, of course, is our fatality rate, which is the 6th lowest in the nation. Number two, since the very beginning, all the way back to March, one of the things that we were working to do was to slow the spread, to make sure that we had adequate hospital capacity, both in terms of beds and equipment, but that also that we had appropriate staffing, and also, of course, by slowing the spread. If you get sick today with COVID, you have a better chance of recovery than you did 6 months ago, because the medical community understands so much better about how to treat the disease with therapeutics. And of course, as we slow the spread, it also gets us closer to the day when there may be a vaccine that would help protect populations from this disease. Number three, so first goal was protect the most vulnerable. Second was ensure we had adequate healthcare capacity. The third was to save lives and livelihoods. And we have, since the very beginning, not just been focusing on physical health, but also mental and behavioral health, which again can be accentuated by challenges through isolation. Economic health, which we know contributes greatly to the factors of well-being. And then, of course, those things are all tied with making sure that we keep our schools operating and keeping kids in school and keeping our universities going. These are all important things to help, because education and all of the nutrition and mental and behavioral health systems that use our schools to help deliver to all of the 120,000 plus school kids in our state all matter. So again, protecting the vulnerable, ensuring that we've got adequate healthcare capacity, saving lives and livelihoods, that has been our goal since the beginning. We continue to learn more things about COVID, and one of the things that we've all talked about and heard about nationally is the asymptomatic, or people that do not have symptoms can still have the disease. People who do not have symptoms can still be contagious in the sense that they can transmit this disease. So again, I want to thank all the hardworking people on our health analytics team within the North Dakota Department of Health who've been digging through all the case data that we have, and we now know specifically, not on averages, but specifically in North Dakota, that of the 10,467 North Dakota COVID-19 cases, 5,858, or 56% of those, have been asymptomatic or without symptoms. Again, let me say that again, 56% of the cases in North Dakota, people who tested positive, were not reporting any symptoms at the time they were tested. This is why we have, since the very beginning, been trying to build a testing system that allows us to test people who are asymptomatic, but may have concerns or may have knowledge that they were in close contact, for example, of someone who was positive, because we need to track not just those people with symptoms, but those without symptoms, because that's the way we're going to slow the spread. When we take a look at the age breakdown of these enormous cases, 56% of them in North Dakota, 58,058 cases. When we take a look at the age breakdown, we can see here that the The green, the darker green, is people who were symptomatic positives, meaning they had the symptoms like, sore throat or cough or those things that you'd see with an upper respiratory disease. The lighter green underneath is the asymptomatic, or people without symptoms. And while we do have a bell curve of population to consider this as well, but these are just the actual cases. You can see that we've got a significant number of these cases are in the 20 to 29 and the 30 to 39 category. They're in the middle of the graph, and of course those are people that are probably also more likely to have transmissible moments, either because of work or occupation or socialization, etc. And so again, this is why it's even more important than ever that when we're thinking about whether it's back to school or school starting, that if you've got young people that are highly social, that are asymptomatic, all the more reason that we focus on Mask Up North Dakota, which we announced last week. And of course, again, we're just encouraging people to understand that even if you, obviously, if you've got respiratory symptoms, you should be staying clear of other people. We've said if you're not feeling well, stay home from work and make sure that you're practicing all of good North Dakota SMART guideline practices. But we again are encouraging people that are if you're young and you're healthy and you're heading back to school or university, back to K-12, we're encouraging people to mask up, because this is one way we know that we can absolutely slow the spread in our state. And it's not, masks don't restrict freedom. This is our path to freedom, because this is the way we can keep our schools open, get events going again, get back to all the things that we love in our state. And again, you wear a mask when you're not able to socially distance. There's lots of places in North Dakota where you can socially distance, but if you cannot, that's a good time to mask up. And then let's jump into the numbers, if we could, and take a look at what we're watching again. We've got, over the past week, we've got 1,507 new cases, but we've also had 856 recoveries in the last week. We've also, again, sadly had 8 deaths in the last week. That puts us now at 1,784 active concurrent cases. That's up more than 500 active cases compared to a week ago. A number of this increase, we believe, is due to the efforts that we're making to make sure that we're testing people as we head back into the university system and get those going again in our state. The positive test rate conducted over the past week, 4.1% across all of the North Dakotan tests, so that's 1,507 positives out of 36,367 tests, or the 4.1%. And again, across that, we did test new North Dakotans, 12,592 new North Dakotans, individuals, and 23,755 repeat or serial tests. We now, in total, have now completed 442,896 tests of North Dakotans, and of those, that includes 195,118 unique North Dakotans. And that means that approximately 1 in 4 North Dakotans have had at least one COVID-19 test. And again, we appreciate the efforts of everybody involved in this, because the testing has been one of the reasons why we've had such good numbers and have been be able to manage this in such a strong way throughout the whole pandemic. The state 14-day rolling average, which we also take a look at each of these briefings, is up to 3.7%. And we show also on here counties, Cass County and the Burley-Morton counties, which we've included for some time. Burley-Morton rising slightly to 4.7%, and Cass County, again, with a slight uptick. But when we take a look at the state number as a whole, rising faster than either of these two counties, and that's driven by new positives that are showing up in other parts of the state. But again, it's not going in the right direction when we take a look at the overall positivity rate for North Dakota. But still, again, when we're at this number below 4% on this rolling average, still among the lowest states in the nation. One thing that we want to mention about that rate, that 5% rate, when we do get to an absolute rate, state rate of over 5%, where we're below 4 right now, but if we get above that, that would trigger some other states do have travel advisories for North Dakotans regardless of if you're from a county in North Dakota that's got 0 cases or one that has more than that. But again, in terms of the ability for North Dakotans to continue to if they have to for work or essential travel, to travel, again, collectively, there are some positive things for all of us if we can keep that rate below 5% as a state. In terms of hospitalizations, which again we said one of our top 3 strategic goals that we've had since the beginning, this continues to be managing very well. We're off from the peak that we were a few weeks ago. We're at 53 hospitalizations right now, and again that represents very few of the hospital beds available in the state. And so again, kudos and credit and thank you to all of the great folks that we have, the frontline workers in healthcare. As I mentioned, sadly, we have had 8 deaths over the last 7 days. A woman in her 70s in Burke County, a woman in her 50s in Benson County, a woman in her 60s in Walsh County, a man in his 70s in Rolette County, a man in the 80s in Burley County, a man in the 70s in Rolette County, a woman in her 90s in McIntosh, and a man in his 90s in Morton County. And all of those 8 individuals had underlying health conditions along with COVID. And as always, from the First Lady and myself and Lieutenant Governor Brent Sanford, our hearts go out to the families and friends, because regardless of age or circumstance, it's always an awful thing to lose a parent or a grandparent or a friend or loved one. In terms of the active cases statewide, when we take a look at the map, we now have, of all the 53 counties, we've only got 2 right now which do not have active cases. That'd be Towner up on the Canadian border, and Slope County in southwestern North Dakota are the only 2 that don't have at least 1 active case. We have a number of other counties which are, as you can see on the chart, only have single digits, a number of counties with only 1 case. In terms of those counties with the most number of active cases, just looking at the numerator, not looking at population, but Burley County with 405, Grand Forks moving up in the number 2 spot with 488, and Morton, which of course right across the river from Burley, puts Burley Morton just under 500 cases. With that 499 cases, Burley Morton makes up 28% of all the North Dakota active cases, but it only accounts for 17% of the North Dakota population. So again, any of these areas that you can look on the map with high case counts, if you live in a county that's got 0 or 1 accounts, and then you're traveling, whether it's to shop or visit or heading off to university or seeking health care or whatever it is, if you're traveling to one of our more metro or higher population counties that have higher case counts, again, another reason to mask up, even if you may feel you don't need to do it on your farm or your ranch or wherever you are in rural North Dakota. If you're coming in to these communities to shop, protect yourself and your communities back home. Don't come to one of these areas and then bring COVID back to your community. So again, another reason to mask up North Dakota. Want to just also throw out here again on a we talk about contact tracing a number of times, but what I'll call a Sturgis update. We know that a lot of people really look forward to participating in that great event in our neighbor to the south in South Dakota every year, and we do know both by observation and by data traffic numbers that there are thousands of people that travel through North Dakota, perhaps across I-94 and down Highway 85 to get to the Black Hills. So far, the North Dakota Department of Health has reported through contact tracing 21 cases, positive cases in the last week that were linked to the Sturgis motorcycle rally. And if you attended the event, we highly encourage you to monitor your symptoms closely and to get tested at a local testing event. And testing events, of course, can be found at health.nd.gov/testnd. And when we take a look at these, this is what I'll call it a mega event. I think it was estimated there was over 250,000 folks that were there, and there is some indication that the spread from that is heading out, nationwide, because people came from around the nation, then went back home again. But the ramifications of those events typically now seem to be showing up 14 to 21 days after the event, once the person has acquired it. So again, as we've said all along, if you have an opportunity to avoid large crowds, or if you're in larger gatherings, keep your distance within those larger gatherings, and again, help reduce the chance that you're going to come into contact with someone who may have COVID. I want to also talk a little bit about the risk levels. Because at current course and direction, active cases, positive cases continuing to rise, that would mean that we'd be heading towards a yellow risk level. We're not making any changes today to the risk levels, so we remain where we are statewide, but we are going to be working with local officials in several counties about potential moves to yellow next week. We talked about doing this on a county by county versus a statewide basis. You saw from the earlier map that the distribution of cases goes from none to almost none to hundreds, depending on which counties you're in. Those counties tend to be those counties with high counts, high active counts, tend to have higher population density, like Burley Morton, like Stark, like Ward, like Grand Forks or Cass. And so we'll continue to work with local public health, with mayors and county commissioners, and have some conversations to see about what can be done locally, short of individual task forces or other work that can be done to try to help make sure we can stem the tide in the counties where we're seeing the count increases. We've also learned a lot since last spring. We established 11 gating criteria that were part of this color scheme for rating risk levels. We are going to be reviewing those. Some of the factors that we included in those 11 aren't as relevant now, and some of those factors that we included we're not able to get. Some of those are national in scope, and we're not able to get county data on some of those. And so we want to make sure that the factors that we have are relevant and can be used if we're thinking about using this on a county by county basis. So anyway, we'll be continuing to have that dialogue over the next week, and stay tuned for next week if there are potential changes on the county level. Next topic we want to talk about is on August 8th, President Trump signed an executive order related to the Lost Wages Assistance Program to ease economic burden for those who had lost their unemployment because of the coronavirus pandemic. What the president did, there was gridlock in Congress, and some of the prior benefits for those unemployed had evaporated at the end of July. The president authorized FEMA to spend a portion of the disaster relief fund that they had to be able to provide additional benefits. For most states, that meant $300 a week in supplemental unemployment events. Since that announcement on the 8th, we've been reviewing the program, looking at the data, and there's a lot of factors that went into this. But I am going to announce today that we're announcing that we have submitted our application to FEMA to participate in the Lost Wages Assistance Program, and this will provide much-needed assistance to North Dakotans who are facing unemployment through no fault of their own. Through this program, to qualify for the program, the individuals will have to have been unemployed in the weeks of the 1st, 2nd, and 3rd week of August. The executive order and the FEMA bucket where the dollars are coming out with, it's estimated that nationwide that there would be enough money to pay for 3 weeks of benefits if all states were participating. And it's important to note that this program is not a smaller version of the federal pandemic unemployment compensation program that expired at the end of July. That was all-encompassing, $600 benefits to all claimants, literally without limitation. In contrast, this executive order is more targeted and limits eligibility in two primary ways. One is that only the claimants who are unemployed specifically due to the pandemic are eligible, and those claimants with a weekly benefit amount of $100 or less are ineligible. And so based on these limitations and through the work that our job service team is doing, we estimate that there may have been approximately 17,000 claimants in North Dakota those first 3 weeks of August that could be eligible to receive an additional $300 benefit on top of the benefit that they were already receiving from the state of North Dakota. That's about 41% of the active claimant base. Should note that the active claimant base dropped substantially, over 15% drop in the claimant base the first week in August when the $600 a week ended, and we saw that the ending of that coinciding with the number of people getting back to work. One thing we do know in North Dakota is that there are jobs available in North Dakota. There are an estimated, just through job service, there's 11,000 jobs that are 11,760 open jobs, and that's only about 1,900 fewer jobs than were available last summer at the same time. We're seeing the number of job listings steadily increase. We still need a strong workforce to fill those jobs. And as we also know that companies that if they have an opening, if they have, say they need to hire 10 nurses, they might only post one job opening for a nurse, and when it's filled, they just leave the posting out there. We do believe that the job service underestimates the jobs available in North Dakota. Prior to pandemic, was a pretty solid estimate that it underestimated by a factor of 3, that there was over 30,000 jobs available in the state from surveying employers. Now we think it's at least 2x, and so there's likely as many as 22,000 jobs available in North Dakota today. I want to again talk about how this is different than the other one. When in the $600 program, which was paid out over many months, North Dakota distributed almost over $400 million in that program. This 3-week period for just those that are eligible will be about a $15 million program, so still important to those individuals, but very different in size and scale in terms of programs and in terms of stimulus. Again, the most important distinction here is that to be eligible for this, the lost wages assistance, workers have to self-certify that they were unemployed or partially unemployed due to disruptions caused by COVID-19 as part of the initial unemployment insurance claims that they had already made. And because it's retroactive, we know that it's not incentivizing workers to stay on the sidelines now. And if you aren't on unemployment today, applying today does not qualify you for this, because this goes back to people for the first 3 weeks in August who are unemployed due to COVID. And we've talked all along about saving lives and livelihoods. Restoring a strong workforce is an important part of this. We are grateful to President Trump for taking action to create this program and provide immediate relief as Congress continues to be in gridlock about any agreement on further coronavirus relief. And the other thing that I say again, when we didn't take this decision lightly, there's many factors to balance. First of all is that we're very thankful that North Dakota has one of the strongest unemployment programs in the nation. North Dakota's average weekly benefit is the 4th highest in the nation at $474. Compare that to some states, Mississippi, Louisiana, Alabama, where the average wage was $211, $215, or $231. And so when they were adding the 300, it was getting them up, barely ahead of where we were without it. And again, as a state, in addition to the $408 million that came from the federal program, all totaled, we've paid out more than $730 million in unemployment benefits to 81,000 individuals during the pandemic. And again, this is again one of the strongest and most beneficial programs in the country, even without the federal assistance. Our unemployment rate in July was the 8th lowest in the nation at 6.6%, and our recovery, continues to move forward here in North Dakota. We submitted the application to FEMA today. There is a number of programming changes that will have to be made. We anticipate that we'll get quick approval from the White House, and we anticipate that the lost wages payments could be going out by mid-September after we make a number of computing changes. And again, they'd be going out to people that were already unemployed during the first 3 weeks in August. Next up is a CARE-19 alert update. Last week we announced the new CARE-19 alert app. It's been a couple weeks since this, but as we say, add your phone to the COVID fight and help North Dakota stop COVID-19. The CARE-19 alert and CARE-19 diary are two separate apps. Both of them can be found either at the Apple Store or on on Android, and you can find those and download those applications. Both of them ensure your privacy. One uses GPS, one uses Bluetooth, and this is again completely confidential. Each of them use anonymous random keys that allow the application to know where you may have been in contact with someone else who then reports positive. And so again, particularly if you're finding yourself either choosing to or unable to avoid being in large crowds, these are particularly helpful applications. The Care Alert, they work better the more people that use them. And again, we want to thank the team at Proud Crowd for the great work that they've done to be among the first in the nation. They've added some new updates that have made it even easier, added capabilities to our universities to make them even more valuable. And so again, we want to thank people. There have been over 5,000 people who have already installed this application. Thank you to those who've taken the initiative to add Care Alert to your COVID fight. But we know that the more people that use them, the better and more useful they're going to be. This is, again, these applications are free, they're low cost, you don't have to do any work. And again, this helps you know your status of who you've been in contact with. And certainly if you do become positive and are contacted by a contact tracer, the CARE-19 is really a tool for you. Again, you control all of that data, but you can use it to help you remember where you might have been and who you might have come in contact with. So again, download CARE-19 Diary and CARE-19 Alert and turn them on if you haven't. And again, thank you if you are. Next topic has to do with a quick public service announcement about the census. Again, we're going to throw a map up here. We've talked about this all along. The census also been disrupted by the pandemic, but they have begun doing door-to-door visits. And so again, the census workers, also known as enumerators, are physically visiting households who have not yet responded with the intent to get them to fill out the census. Those enumerators will be wearing masks when they come to your door. And again, now 53% already in the state of North Dakota of non-responding households have had someone physically visit them. The chances of being visited by the Census Bureau are nearly 100%. They will come to try to interview you to fill out your form. It's that important if your household has not responded. If you do not want enumerators coming to your door, there's some pretty simple things you can do, which is you can go online, my2020census.gov, or you can call phone number 844-330-2020. You can do that and do a short phone interview about the census, or if you've got your census, which you've received, fill it out and mail back the paper questionnaire. As of August 24th, North Dakota's self-response rate is only 63.6%. This closes out at the end of September is the new deadline. But we're below the national average. We're lower than we were in the 2010 average, and we've got a lot more people than we did. And I think I've said this before, but if we just miss 1% of the households in North Dakota could cost us almost $70 million in lost federal funding over the next decade. So you count, your participation matters. It matters on the local level because this helps drive dollars, make sure that your community and your county gets its share of federal funds for schools, hospital, roads, public works, and other vital programs. We've got some great performances. They're shown here in the darker blue that you get on this slide, the better the performance. So Burleigh County leading the way here in North Dakota at 77.2%. Morton County next door 71%. Stutzman County, home of Jamestown, home of the Blue Jays, 70.2%. But our most severely undercounted areas in the state are rural and western counties and our tribal nations. These are counties that absolutely positively need to get a accurate, complete count, and they also need the federal funds associated with that. So Roulette County 31.4%, McKinsey County 32.7%, Sioux County 33%, Montreal County 35%, Benson County 36.6%, Divide County 40.7%. And so again, to all of those counties, again, whether you're county officials, tribal officials, mayors, anything you can do to help encourage people to fill out that census is going to help your community. And of course, we also know that the private sector in the next 10 years often uses census data to decide where to build factories, where to put in new stores, which create jobs, and the funding for important federal programs such as the National School Lunch Program, Head Start, special education, Pell Grants, supplemental nutrition, child care, housing assistance, and more all relate to this. And again, the Census Bureau data is not available to any other government agency. And so again, if you can, please do. If you haven't taken the census, please do now. As I said at the outset, we're delighted to have joining us today for an update on the Economic Resiliency Grant Program is North Dakota's Great Commerce Commissioner, Michelle Kommer. Michelle.
Thank you, Governor Burgum. The North Dakota Department of Commerce continues to receive applications for the Economic Resiliency Grant, or the ERG. Thank you, Lindsay. That launched 2 weeks ago on August 12th, so it'll be 2 weeks tomorrow. Commerce's Economic Resiliency Grants provide funding to businesses to make infection control improvements in order to reduce the spread of infection and inspire customer confidence to return to the marketplace safely. The Commerce team is working diligently to get funds into the hands of North Dakota businesses to implement these improvements. As of this morning, more than 3,000 ERG applications have been submitted, and more than 500 have been reviewed. So far, Commerce has awarded more than $2.85 million to 137 businesses. Applications have been received from 52 of 53 North Dakota counties, 248 communities, representing a wide range of industries from hospitality to child care facilities to wellness and medical services. Here are a few examples of the improvements that will be made by grant recipients. The Greater Grand Forks Convention and Visitors Bureau was awarded funds to purchase masks for visitors and event attendees to help stop the spread of COVID-19. Julie Rigg, the Grand Forks CVB director, said, "The Greater Grand Forks Convention and Visitors Bureau is so appreciative of the Economic Resiliency Grant. The funds that were awarded will be utilized in purchasing masks for events, conventions, and tournament attendees in our community as we want to ensure that our visitors feel safe and comfortable in the Grand City." Baker Boy and Dickinson was awarded funds to purchase new technology to enhance safety protocols to create a safer work environment. Guy Mose, president of Baker Boy, said, "As a food manufacturer, Baker Boy is part of America's critical infrastructure industries. Every day we make food products for our state's schools, restaurants, healthcare systems, supermarkets, and many other food service operators. Our main priority through the COVID-19 pandemic has been to ensure the safety of our employees, their families, our community, and our customers. Thanks to the North Dakota Department of Commerce's Economic Resiliency Grant, Baker Boy will be able to install new technology that will greatly advance our safety protocols and create a safer environment for our 225 employees. These advancements will help our employees continue coming to a safe workplace and ensure that we continue producing our wonderful products, donuts, that not only help feed the great people of North Dakota, but all Americans." Bones Barbecue in Minot will be implementing an outdoor patio area to create a socially distant, safe dining environment for customers. Jerome Lundeen, the owner, said, "The North Dakota Economic Resiliency Grant has enabled my business, Bones Barbecue, to safely welcome back our customers by building a beautiful outdoor dining space, allowing for social distancing. I love seeing our customers back, chatting with each other and my staff. The energy customers bring is encouraging." These are just a few examples of how dollars are being allocated to businesses for improvements that reduce the spread of infection and instill customer confidence in the marketplace. You can look for other great examples that will be featured in the coming weeks on our social media channels and our newsletters. The ERG application window will remain open until August 28th for the first round of funding. This is a reminder that grants will be awarded for up to $50,000 per eligible business or up to $100,000 for eligible businesses with multiple locations. Also, if you have not already applied, be aware of some of the most common reasons for denial. Remembering that the spirit and intent of the grant is to reduce the spread of infection in order to inspire customer confidence to return to the marketplace, we have rejected applications where the applicant has not demonstrated that it has a marketplace. In other words, a business setting where customers purchase goods or services for money. Examples of businesses that lack a marketplace under this definition would include an office environment without a customer presence, like a call center, or a company that doesn't interact with a customer, like a roofing company. Another common reason for denial is that the applicant has not described how the investment reduces infection. For example, the expansion of warehouse space or some other capital improvement that has no apparent nexus to infection control, or where the applicant seeks funding to expand into a brand new line of business. Also, where the applicant seeks funding for what they are calling, or what we are calling, version 2.0, an upgrade to existing equipment where the improvement in infection control is not specifically demonstrated. The grant was not intended to support these types of investments. Updates will be available at ndresponse.gov through the ERG banner at the top of the page. You can look forward to more examples for uses, as I said, of the ERG through the Commerce Department's social media channels and through our newsletter. Thank you.
Thank you, Michelle, and great examples of some great North Dakota companies, including Baker Boy, where I've had a chance to tour their amazing plant, where love of making amazing donuts meets innovation. If you ever get a chance to make that tour, get a chance to do that. And great donuts at the end of the tour. Moving on to our next topic. Is behavioral health. And as the start of school and fall activities, we know that can be a stressful time under normal circumstances, let alone during a pandemic. To help parents and children maintain and develop strong and open communication and to support children during this transition back to school, the North Dakota Department of Human Services Behavioral Health Division has created a new toolkit for parents called Parenting During a Pandemic. The new Parents Lead resource touches on a variety of topics, including how to support children going back to school, whether they're going a few days a week or participating in distance learning, balancing teleworking with children at home, supporting a child when they're grieving the loss of activities, knowing when a child is ready to stay home alone, age-specific ideas on supporting children impacted by COVID-19, and more. And of course, this new resource can be found at parentslead.org/COVID-19. Behavioral health continues to develop new resources not only for parents, but for community members and professionals, and all individuals are encouraged to check Parents Lead website regularly for new resources, new links to helpful information and updates on supporting families during these times. So if you've got any children heading back to school of any age, check out parentslead.org. Under the good news section, North Dakota Department of Transportation, of course, was one of those agencies that was severely impacted by COVID because prior to March, there are a lot of in-person transactions related to, and not just a few, hundreds of thousands of transactions a year between citizens and the Department of Transportation, whether that was vehicle licensure, driver's licenses, tab renewals, all of those things that go on, really large volumes. But we understood that even as we created a bit of a backlog during last spring, during the beginning of the pandemic. We're working to do that. We knew that we had to expand capacity because we had some service levels that weren't at the levels that we wanted them to be. And so one of the good news today is that the DOT has done a great job of expanding an existing contract for handling phone calls with a North Dakota-based company. And the North Dakota driver's license is now averaging more than 1,000 calls every day. The average wait times have been reduced dramatically. I mean, this shows you how overloaded the team was before. Some of those are in excess of 40-minute wait times. And since August 18th, the average wait time has been reduced to less than 2 minutes. And again, as a reminder, for people that have got a driver's license by executive order last year, we changed some of the dates when they were required to be renewed. Now it's on a rolling schedule. So if your license expired in March, April, or May, it must be renewed no later than September 30th. License that expired on June 20th must be renewed no later than October 31st. Licenses which expired or will expire right now in July, August, September, October must be renewed no later than November 30th, 2020, and licenses which expire in November and December must be renewed by the end of the year, 12/31/2020. The schedule for motor vehicle tab renewals is different than for driver's license. Motor vehicle tabs that have expired at any point in time during this pandemic must be renewed by a date that's coming up very closely, August 31st. And again, remember, you can call about that. Again, 1-855-633-6835, or at the website at dot.nd.gov. And there are also, of course, kiosks located around the state where you can go to a kiosk. You do not have to come to an NDDOT location to get your tabs renewed. And again, if you call and schedule an appointment, many driver's license services such as address change, renewals, replacements, and more, all of those, again, available online. So if all you have is trying to renew it, changing an address, getting a replacement, go online versus making an appointment. So again, thank you, and for all the good news coming out of DOT. Under the gratitude section, we want to also hail an important anniversary. Today, August 26th, 2020, it marks the 100th anniversary of the certification of the 19th Amendment of the United States. This, of course, is this 19th Amendment to the United States Constitution recognized the right of American women to vote and have a voice in government, ensuring their right to exercise the power of the ballot and help shape policy in the future of the nation. 100 years ago was 72 years too late, and some may say even later, still later than that, but it was formally 172 years ago was the beginning of the women's suffrage movement. And again, today, gratitude to all of those leaders that fought for voting rights leading up to this historic change on August 26th, 100 years ago. The picture that we're showing here dates back to 1917. That's Governor Lynn Fraser from North Dakota. The North Dakota legislature passed some limited voting right capability for women that was preceded the federal change. But again, so North Dakota was slightly ahead at least on some front of that 100 years ago. But again, many people have continued to fight this important battle and make strides recognizing the voting rights of women, minorities, including Native American and African Americans in the last 100 years. And today we reflect with gratitude on the courageous suffragettes and whose tireless efforts have made our nation better and more inclusive for all citizens. And one quote to help bring us back to that time over 100 years ago was from American suffragist Abigail Duniway, who said, speaking contemporaneously over 100 years ago, she said, "The young women of today, free to study, to speak, to write, to choose their occupation, should remember that every inch of this freedom was bought for them at a great price. It is for them to show their gratitude by helping onward the reforms of their own times by spreading the light of freedom and truth still wider. The debt of each generation owes to the past, it must pay to the future." And then also from contemporaneous from that same time in the late 1800s, Lucy Stone, another American suffragist, said, "I think with never-ending gratitude that the young women of today do not and can never know what price their right to free speech and to speak at all in public has been earned." So we've come a long way from more than 100 years ago. As Americans, we're fortunate to benefit from the efforts of those who have come before us, and our rights and freedoms have been hard-won and fiercely protected. I want to also give a personal shout out to my great-grandmother and many other people's great-grandmother, but Linda Slaughter, one of North Dakota's early pioneers, who was also an early suffragist and spent a lot of time in correspondence with people including Susan B. Anthony and trying to drive voting rights in North Dakota, even up at the time of its statehood. They were fighting for it to be included in 1889, but they got it done in 1917. So anyway, we're grateful to all of these incredible women and men who've come before us and for the legacy they've left, and America has a responsibility to continue working to create a better nation for those that come after us as we go forward. With that, we'll conclude the formal remarks portion of our press briefing. We intend to be back here next Wednesday at 3:30 p.m. for our next briefing. We'll stand now for questions. We have with us today Bryan Klipfel is here from Job Service if there are any more detailed questions about lost wages. And then Michelle Kommer is also here to talk about the ERG grants. And as I put in a press release earlier this week, my extreme and deep gratitude for Michelle and her leadership the last three and a half years of numerous state agencies, including Commerce, but any questions about her return to the private sector, she's going to be available after we conclude remarks, and people can talk to Michelle separately, and we'll stay focused here on this briefing on coronavirus and ERG and the announcements we've made today. And I wasn't looking down to see who got first. Jacob's pointing at Jack. You were first up, so Jack, first question.
I'd like to drill down a bit on changing risk levels. You said you're not doing this today, but potential moves to yellow next week. Could you expound on what counties you'll be visiting with? And is that definite that next week some counties will be moving to a different risk level?
It's not definite, but it's I'd say it's everything I said has always been on the table, but maybe it's moving to the front of the table. We'll take a look at see how the numbers go the next week. But I think I enumerated this earlier, which is counties that are that have high population density and high case counts, and that would include Stark, Burley Morton, Cass, Grand Forks and Ward are the ones that if we were looking at it today, but we'll, like I said, we'll be reaching out to mayors and county commissioners and local public health officials in those communities, university leaders, everybody there just to keep this conversation going about what we can do. If we've got, a lot of positives that are coming up in some of these counties, but they're like UND's been doing a fantastic job. They've identified a number of asymptomatic positives. They've got those people isolated in local hotels. They're tracking the close contacts. So if you've got a great effort going like that, maybe there isn't a need to make any change in risk level, because even though you could have higher active counts, people know where they are, and they're doing all the right things relative to quarantining and isolation. And so again, we're going to want to apply very targeted and very local decision making as we think about changing any risk levels. Jeremy, and then Jacob.
I have several questions about risk level. I guess I'll try not to ask them all at once. I guess if you change it at a county level, what would be the functional change for those counties? What restrictions or recommendations would change in those cases?
Well, in the guidance which is still out there, so everybody can go read it on the risk levels, is there's changes in, and again, these are all guidelines, not mandates, and they're not sort of legally enforceable. This is just guidance, if you will, but the guidance would include density of seating at restaurants, group size, all the things we talked about last spring. But we want to take a closer look at that. In terms of we said we want to review all these guidelines, make sense. Some other states, when they saw their numbers increasing this summer, for example, closed high density bar service where there weren't tables, where you say you've got a bunch of people standing at a bar, but they kept the restaurant portions open. open. And again, that's more of the scalpel versus the sledgehammer approach, because again, we're trying to reduce transmissible moments where they might occur within the populations or the age groups that might be most likely. And again, as we said today, with 56% asymptomatic, it's and lots of people in that 20 to 29 age group, it's pretty easy to start bringing your focus back around and understanding why in other states, when they cut down activity around crowded bars, that caused a drop in transmission.
One follow-up here. I believe it was you or somebody from your office who said you'd like to keep the state all on the same risk level. I guess why the change of heart here potentially in changing one county or two counties?
Well, we have said that would be our preference, but at the same time throughout we've said if need be we would we would make the changes on a county level. And I think, again, when you see the extreme differential that we have in North Dakota, again, I mean, Burley Morton, 500 cases, and then I can name, 5 other counties together that don't have 5 cases. And to the degree that we might be considered to be sort of economically penalizing businesses with guidelines to cause them to restrict their business when there isn't really a risk of community spread in their communities or very limited risk, then again, we're trying to be thoughtful about balancing all of these different objectives. Okay, Jacob?
Governor, going off of that, the increase in positive cases and increase in positive rate, been going on for a little while, nothing new. What was the tipping point? Was it a tipping point in data, tipping point in people recommending a change in the threat level? What changed last week to this week?
Well, I don't think anything's really changed. I mean, I think have been watching closely, and I think the thing that we're watching closely this way is trying to really understand what the impact of the testing related to back to university was going to do, and I think that we've seen some of that impact in the numbers this week, and so we're as we get through that, I mean, again, there's this initial surge, if you will, of back to school testing. So we want to take another week, take a look at it, but I wouldn't say that anything's really changed dramatically. We're just, again, we feel good about where we are, but we don't like necessarily the direction we're going. And so, again, we want to, encourage North Dakotans not to be complacent right now. This is a time for us to be proactive, because we have an opportunity to get everybody back to school, keep our businesses open, keep everything going. We have a chance to do that, but it's going to really require that people take seriously the North Dakota SMART guidelines. It's an important thing, because we know that these are low cost, and if you're a fiscal conservative, keeping a distance and wearing a mask are basically free activities that help save our economy, save our schools, help our school children, and so again, we're asking everybody to do their part to help slow the spread. Okay, I'm going to go to online and then to Lane.
Jean Shemp, Hometown Radio Group. When you first implemented the North Dakota Smart Restart Plan, restrictions for businesses and large gatherings were mandated, but a few days later those mandates changed to guidelines that may or may not be followed today. If we move certain counties to the yellow risk level, how will this change anything if businesses and gathering restrictions are not mandated, and why did you change from mandates to guidelines in the first place?
Okay, there are several questions in there, I think, from Jean, but I think that the quickest way to answer this is with the same line we've given before, or not line, but the same answer consistent we've been throughout the 5 months, which is it's not about what government says, it's about what people do, because you can have a mandate, but then the next question is how do you enforce it, and we practically in the state of North Dakota don't have the desire, the wish, or the interest, or the capacity of law enforcement to be trying to figure out whether seating in a restaurant was at 55% versus 49%, or et cetera. So the enforceability is a real issue. I think what we have all along here has been trying to appeal to the sense of community and the sense of collectiveness, this idea that we're all in it together, that we need as a state, as families, as communities, as schools, understand that our actions do impact during a pandemic. Our actions and our choices impact those around us. They can impact those that are the most vulnerable. And so this is again, an opportunity. I guess, I mean, there's been examples where we've seen communities come together, whether it's in Minot or Fargo, where the entire community comes together during a time of flooding, and everybody understands that if you work together, you can save the community. I mean, I guess I would appeal to the spirit that we've seen many times. I mean, it's a lot easier than filling 14 million sandbags like this happened in Cass County. It's a lot easier just for people to wear a mask and keep their distance and wash their hands. And so we think that's the most powerful tool we have. Changing the color scheme is, again, by changing the guidelines, could be a strong signal to some counties that they need to pay more attention to compliance, but that's what it is. So again, today we're just, again, appealing to the state of North Dakota to be North Dakota smart, and that's our path forward. That's the path to freedom right now, is keeping everything open and keeping the schools open, is everybody being smart about not allowing yourself or others to be in a position where this virus can only live when it jumps from human to human host. And so if you take yourself out of hosting the virus business, then you're helping everybody. Okay, it was Lane, and then we're going to go back online before we come over this way.
Governor, we've heard from a couple members of the Burley-Morton Task Force saying that they would like to see the risk level brought back. Have you heard from any other counties saying the same thing, that to kind of prompt this look into county by county next week?
Well, we've heard both sides. We hear from some people that they want it raised, and we hear from other people that say they don't. And so it's a mix, and we're trying to sort through all those different voices. And I think that's why this week it's important for us not to try to make a decision here without local input, which is why we're going to. Without formally creating task force in these other counties, just spend some time talking to leaders in those communities to see if we can get sort of the ground, I would say ground truth, but if a community felt like, hey, this would be a huge asset to us in helping drive compliance at limited cost into either getting kids back in school or keeping health in the economy, we want to listen to what the local officials have to say. So we want to get their input, and that's what we'll be doing in the next week.
Mike Smith, 660 KUYZ in Williston. If one county moves to a higher risk level, how will you enforce travel from one county to another to make sure people don't travel to an area with less restrictions? For instance, someone going from Cass County to Richland.
We would not be trying to. There's it would be no attempt to try to reduce travel. We're just trying to increase awareness about where the virus is today and how it spreads, and us all working together to reduce that. Because even at the same risk level, the whole statewide risk level, there have been through this entire pandemic certain counties that have had more cases than others, and other places have had higher risk level than others. And again, as I said at the onset of this briefing, that if you're traveling from a rural area with low or no COVID to shop or to visit or to do anything in an area, then that's probably a place where you should exercise more extreme care about following, either mask up North Dakota or following the guidelines, because just mathematically you're more likely to run into the virus or a person carrying that virus in those areas. Back to Jeremy and then Jacob.
Governor, you mentioned changing those 11 gating criteria for risk level, but you've also frequently spoken about not moving the goalposts. How do we reconcile that?
Well, I'd say we aren't moving the goalposts. The goalposts are the three things we talked about at the beginning about protecting the most, vulnerable, preserving hospital capacity, and then saving lives and livelihood. I think when I take a look at the 11 criteria, some of which we developed last spring, is we're a lot smarter now about what matters. And like I say, there's some gating criteria that's in there that is not, some of the data is not available at the county level. So if we do make changes, we'll provide examples of what we added, because we may add some new gates, if you will. At the same time, we may modify or take some away, but we're not trying to lower a bar. We're trying to make it a smarter bar. Jacob?
Governor, earlier this week, the CDC said that, they changed their guidance on testing for close contacts, saying that people who are in close contact don't necessarily have to be tested. you're a data-driven individual. What say you going into the school year?
Well, I'd say that, my reaction to that when I saw that this morning is some of what we've seen from the medical community, which is a lot of a reaction of confusion, because if forget COVID, just take epidemiology, take any pandemic, any disease where it can spread is, if you know that like this case where you've got a disease that's more contagious than the flu, it's less contagious than the measles, but it's it's got that higher R0 factor of, one individual being able to infect multiple others, knowing who the close contacts are matters, and then testing those close contacts matters, particularly in a disease that doesn't reveal itself through symptoms. If you've got 56% of the people in North Dakota who are positive and could be transmitting to others and don't know it, I think it's imperative that we're testing close contacts. So this is in one case where I I would say disagree with and don't understand the latest guidance. Also, at least when I was reading the language in there, there are many caveats that were included in there, including the fact that this new guidance shouldn't have any effect on surveillance testing. Well, surveillance testing is what we're doing to try to understand whether or not we've got COVID coming into our universities at the get-go, as opposed to having it show up and then we have to shut down universities. So it seems to me that this is confusing, and we will keep digging with the CDC. We'll reach out to the CDC and we'll reach out to others in Washington and try to see whether there was the motivation behind the guidance. But I would anticipate that as we head into the fall that there's going to be there'll be a real debate about that guidance, because like I said, this is basic blocking and tackling in any kind of pandemic or highly transmissible disease is finding out who the close contacts were and then testing them. So we intend in North Dakota to continue to do that, because we don't just think, we know that's the most effective way to slow the spread.
You said you're going to be reaching out to the CDC about this kind of thing. Do you see this kind of national tone affecting the state's ability to continue to expand testing efforts?
No, I don't. I think it's too early to tell. I mean, it's too early in this. This is sort of just quickly in this thing. I mean, there could be there could be a reaction, there could be a retraction, there could be clarification, there could be a lot of things related to this, because I think there'll be a lot of disagreement about this particular statement. I'm going to go Lane and then Jeremy.
Governor, with the mention of universities, we've seen spikes in Grand Forks County as well as Stark County, two counties that have the University of North Dakota as well as Dickinson State. Is there a worry that college students are the reason that these spikes are occurring, or is there other things going on?
I would say it's a worry. I'd have to dig a little bit more into Stark County. We know that in Grand Forks, a number of cases there were related to returning college students, and I said that the university is doing a great job of providing separate facilities where people can isolate. They're doing a great job of contact tracing and close contacts, so it's working as we expected. If I didn't say it, I would say I probably should have when he said when we're going to try to test tens of thousands of returning college students in a disease that now today we've got the data that's even more asymptomatic. I probably should have said, hey, we expect the numbers to go up in communities where we've got universities. And that's happening. But to me, that's a good thing, because that means we're finding it and we're containing it and controlling it. And if you go look back and say, hey, look, we've got way more actives today than we did 2 weeks ago, but hospital capacity is, we had less people hospitalized today than 2 weeks ago, I'd say we're doing the right thing. I mean, in terms of finding them, identifying, and moving forward. So when you've got again, transmissible moments come with having schools back in session. And as we get back into K-12 and get back into higher education, we're adding more transmissible moments back into to everyday life in North Dakota. And with that, we have to work even harder to make sure that we're doing the surveillance testing, identifying those positives, and then isolating them. I'm going to go behind you. And sir, remind me your name.
Adam Willis with the Forum.
Yeah, welcome, Adam. Good to have you here. Know the name. Nice to meet you in person.
Point of clarification on the new unemployment program, assistance program.
Would you like me to have Bryan Klipfel come up? Might be fun to do that. If we could, come on up, Bryan. Bryan, of course, leads Job Service North Dakota, and he's been closely involved in the decision, closely involved in managing all these changes to all these federal programs, and was a great help to as we teamed up to try to make this decision about the lost wages. But Bryan?
Okay.
Maybe two questions here. It was my understanding that the 3-week period being covered was an estimate based on if all 50 states signed on to the program. Why the assumption that this will only last for 3 weeks? I know that there are at least a handful of states who have turned down the program.
There's been, right now there's probably 30 states that have submitted their FEMA applications, so there's a bunch to go yet. But if you look at, like say for example, the state of California, their 3-week total is like $4.4 billion. So I mean, there's some big states out there that have a lot of claimants that are going to put in. So if you take a look at those large states, and you look at what North Dakota, we're putting in for 14.7 million, which isn't a lot. However, so if some of those larger states wouldn't put in, it could go longer. But if all states put in the dollar amount that they're eligible for, that it could be, they say it lasts about 3 weeks.
Appreciate that. And then I also saw in the press release put out during this meeting that those payments aren't expected to go out until mid-September. Just wondering if you can speak to the delay that will take before those checks actually arrive.
Yes, I can. I mean, if you look at the what it takes to change these programs. Now, our system is an older mainframe system, but it is pretty much automated. And it's done very well for all the claims that we've had over the last 5 months. But every time you change a benefit, you have to reprogram the system. And it takes a lot of time and work to do that. And for this program, there's 2 things we have to program. First of all, we have to program that where the benefit's going from $600 to $300. And then the second thing is the funds for this program are from FEMA, and they will not let us put it in our UI trust fund, so we have to program our system so that it can withdraw the money from a different bank account.
Appreciate it.
Okay. Thank you.
And just for the IT guys, I'll throw in a little more complexity. Bryan is giving you the top level, but the $600 could have taxes withheld and child support withheld. The $300 cannot on the executive order, so there's more changes. So there's actually, and again, this idea that it's not coming from the Department of Labor, it's coming from FEMA. These are all significant hurdles to overcome. I think virtually every state, it's taking them 2 to 3 weeks to get the changes made to start issuing the checks. And there's a chance that by the time we get it done, we've determined eligibility, that instead of people getting $300 checks, or maybe they'll get $300 checks, but the program could be over in terms of us paying out the $14.7 million almost immediately, because once the changes are done and we make a payment, because this is people who were unemployed the first, second, and third week of August and qualify, that their job was lost due to the pandemic. Okay. Jeremy, and also remember we've got Michelle is also available for questions on ERG as well here. We're going Jeremy, and then we're going, was it online? Okay.
Governor, I wanted to ask you one question about testing. Testing has fluctuated a little bit in the last week here, from low to high and then back to low again. But the average is around 5,000 as it was about a month ago. I'm just wondering, overall, why hasn't testing increased the way maybe you expected it to with school starting up around now?
Well, the answer there is a good question and a relatively simple answer. When we knew that we had max capacity in the lab, and we anticipated the surge of back to school, and we were anticipating by this time to have tested about 28,000 college students, or not necessarily by today, but soon. We're behind on testing college students. We've only tested about 13,000 college students. we made a decision to take what was in some cases 1,000 or more tests a day that were going on long-term care, to move those out of the state lab to MACO, which was a national lab, which again had the capability of having a great website. I mean, we lost some time because we have to transport them, out of state to North Carolina, but we gained some time because once they were done with their test, they could post them, and a facility administrator in long-term care could see all the tests in their facility at one time. So we made a decision to do that. So we moved those out, and then anticipating that we would use up all the capacity in the state lab for the higher education return, and our demand for those tests, execution against those tests, was below what we expected it to be. So we had some, for the first time in a long time, some excess capacity in the state lab. We had a meeting earlier today. We're going to make some adjustments. We'll be moving some of the long-term care back. We're going to work on programs, think about how do we get more higher education testing done, because we want to keep driving that testing number up. And of course, that'll be part of the conversation that we have with these counties is hey, we've got extra capacity right now. Can we do more surveillance testing or more targeted testing in your communities to help slow the spread? I would also say too that we were also on that march towards more testing. There were 2 more machines that arrived last week that were set up this week, which are coming online, and these are 2 more of the Abbott M2000 machines, which is, there's 2 major platforms, the Thermo Fisher and Abbott. I mean, the lab people would say it's good for us to spread our risk in terms of supply chain across 2 major manufacturers, but that's going to be a net gain of 1 because we had rented, we had on a lease of one M2000 machine that's going to go back, and then 2 that have been purchased, and so then we'll be net 1 up, but we're again continue to gain in our capacity in terms of being able to process here at the state lab. And then I would also say too, the state lab's been doing a lot of work. I mentioned here several weeks ago about that we were going to try to condense the amount of cycle time from the time a swab was taken to when we had a result, and we're making substantial progress there and sort of cutting out things that might have slowed down processes or automating those. And we did have some positive feedback from universities where we were getting we're getting responses back in some cases in 36 hours back to people from when they got tested as part of the university. So that's good, but we need to get there because, again, a test is more valuable. A positive test is more valuable if people can find out about it sooner. And so it's not just how many tests we're doing, but the quality and the speed with which we're doing it. So the team continues to work really hard on that front. And again, our lab here is doing, if you look across the whole FEMA 8 region, close to 50% of the tests in the FEMA 8 region that have been done in state-owned labs have happened in North Dakota. 11% of the tests done in state-owned labs in the nation have been done in North Dakota. We're a state that does not have a commercial lab of our own, and we didn't have university labs. So again, there's a remarkable success story here that we were able to have this like 30-fold increase in capacity here in a short amount of time, and doing it the quality they're doing. So again, kudos to National Guard and the lab team and everybody that's continues to work 7 by 24. I mean, that means 7 by 24. There's 3 shifts working there round the clock, 7 days a week. But as you noted, we had a little dip in our testing, and we're going to make sure that doesn't happen going forward. Okay, online, and then Lane.
Sydney Mook with the Grand Forks Herald. How did the universities get behind on testing, and what is being done to ensure students do get tested?
Well, I don't know that they got behind so much as that we I guess anytime you do something for the first time, you learn things new, and maybe it was a combination of marketing, maybe it was a combination of messaging, maybe it was a combination of location, maybe it's a combination of how busy students are, that we just didn't have as much voluntary compliance, if you will, in terms of the demand, but we need to dig in a little more because maybe we weren't in the right place at the right time when students were available to be tested. We think it could be partly the type of testing. So one of the things we are also all looking at is, I mean, anybody that's had the test where they the nasal pharyngeal is the word. Other people might call it, tickle your brain test, because it feels like it's going so far back up into your head. But I think if we can get to a saliva or a nasal swab test, which again, those can be coming this fall. I mean, we might have more willingness for people to get tested or tested quickly if we are able to do that. We're also continuing to work with the universities to get testing labs set up there. NDSU and the lab there that's been part of the vet lab is being converted over. They've got a great, beautiful new facility that'll all be up and running and certified that can be used for the surveillance testing. So we'll also hopefully improve some access to sort of the physical closeness to labs for UND and NDSU students, and also, any students on the eastern part of the state. So it's just a problem we're going to continue to keep working. But we learned that planning on them showing up and them showing up are two different things, and so we got some more work to do. Lane?
When Vern Dosh was here, he had mentioned that contact tracing had slowed a little bit because of the rising cases and all kinds of things. Aside from university students returning, we have K through 12 students going back to school either next week or already maybe even into week 2. Is that going to cause even further problems with contact tracing?
If there's a concern in your question, I share your concern, Lane. And as recently as a couple hours ago, we were talking about, do we need to set up specific teams related to K-12 contact tracing and higher ed contact tracing, or do we need to provide more resources to those communities? And I know that I think the answer is going to be yes. We've known all along that contact tracing is, well, we've been able to bring automation in terms of the back end, in terms of an IT system to be able to record that information and track it. It still involves people interviewing people one-on-one over the phone. It involves people trying to recall from memory where they've been. And so it's largely at its heart, there's still a manual human interaction process that we just, for right now, we don't have any better way to do that than to throw more manpower at it. But of course, there is a better way. That'd be, Care-19 diary, which would help people be more certain in their memory. Care-19 alert, which would allow us to automatically alert people when they've been in contact with people who've been positive. And I say we, meaning not we, because we wouldn't be sending out the alerts. When someone is positive and they're using Care-19 alert, if they choose to, they can switch their phone to say, I've tested for positive. It automatically and anonymously notifies any phone that's been close to them. That's, to me, if I was a college kid going to college parties, I would absolutely have Care-19 alert on, and I would, be encouraging everybody in my pod that I hung out with to have it on as well, because I'd say, hey, let's make sure that if somebody gets it, we all, we all know, who's been positive, and then you get the automatic anonymous alerts. It's just, I would, in my job today, it's important that I know my status. But if you're anybody, if you're a parent, if you're a college student, I think knowing your status matters. In an asymptomatic disease, a lot of people may say, I feel fine, but it doesn't mean that they actually know their status. So in addition to contact tracing, technology can really be an aid there, those two things. But in the meantime, while people are downloading the app, we'll be looking at whether we need to add more contact tracers, particularly in the communities where we're seeing the increasing rates go up. Online.
Scott Hennon, WZFG, KFYR Radio. The previous federal bonus for the unemployed made it more difficult for businesses to hire needed labor. You were critical of the policy, citing what the hourly rate would be with the bonus. Isn't this another hardship for businesses, and why has your previous opposition changed?
Well, for Scott, two reasons. One is the small nature of this, small relative to the not just 600 to 300, but 300 for 3 weeks, and the fact that it's retroactive. So the fact that we're going to go back and put what would be the equivalent of $7.50 an hour as a supplemental piece on top of what someone would have been paid if they were unemployed the first week in August, the second week in August, or the third week in August, and if and only if they were unemployed due to the fact that their job loss was related directly to the pandemic. If those two things have to be in place, and so we'll make that payment for those people that had lost jobs due to the pandemic. We make it retroactively. It's not going to keep anybody on the sidelines looking for employment in September going forward. And so that's why we got there. I'm still highly critical of the in ways the 600 was deployed because again it was 600 for the whole country, and as I pointed out here, some other states unemployment was as low as $211 a week. North Dakota, our average is $474. The high is $640. I mean, we had people that were getting $1,240 a week, with that 600. That's a real incentive to stay on the sidelines. And so we are. This is a very different thing. It's retroactive. It's only going to hit a few number of people, and they have to have already been unemployed due to the pandemic. So we'll see what Congress comes up with next. But this was a way for us to help people who, on no fault of their own, had lost their job. But we again want to reiterate that there are likely 22,000 or more jobs available in North Dakota, and good paying jobs, and encourage people to get their careers going again. Okay, other questions? Got Lane?
Nobody's bugged you about masks, so I guess it's my turn this week. Last month, the state of Ohio, that has a larger population than North Dakota, issued a mask mandate, and they've seen a 31% decrease in the past 7 day, or in their 7-day average. Any thoughts on that?
Well, masks work, and so again, we've launched the Mask Up North Dakota. We encourage people to think about this not only for themselves, but for those most vulnerable. And again, I know that in our state there's that somehow masks have become political. And again, I just want to say, as quote the President of the United States, who said wearing a mask is patriotic. And I think that if you care about getting unemployment down, if you care about getting kids back in school, if you care about the economy going, if you care about the U.S. Economy returning to its previous strength that it was back in March, one of the things that you can do is wear a mask. And so I don't see these things as being opposed to each other. Like I said, I see mask wearing as a path towards fast recovery, and a path towards the freedom that we all love and cherish here in North Dakota. I don't see them as incongruent, but again, we think the best way to get there is by people coming to the realization that they can do their part by wearing one, because again, it's what people do. It's not what government says, and we'd love to have people, join in the fight to help. Just like everybody jumped in and helped sandbag, everybody can jump in and wear a mask.
Forum Fargo-Moorhead. There are reports that President Trump's administration pressured the CDC to change the testing guidelines. It's unclear if it came from the president himself, but should politicians be interfering with health experts' efforts to give guidelines to test?
The first part of that I can't comment on because I have no basis of knowing what went into or didn't go into the CDC recommendation. But I think, as we talked a little bit about last week, which is there at some level, elected leaders, all the responsibility rolls up to an elected leader to balance all of the benefits, because when we talk about sometimes the word health expert has been used during the pandemic, and anyone who is a health expert will also acknowledge that health is directly tied to the social determinants in life, of whether, do you have housing, do you have a job, do you have income, do you have a good place to work, are you able to work because your kids are in school? And so I think it's important for elected leaders to be looking holistically at solutions and balancing all the trade-offs, the mental and behavioral health versus the physical health. This is sometimes framed as jobs versus health, but it's health versus health. And I think the elected leaders in each state's got different demographics, different situations, different levels of different levels of unemployment pre-pandemic, different levels of unemployment insurance they were paying. I mean, it really varies. I mean, one of the great things about the United States is we've got 50 platforms for innovation, and I don't want to be second guessing other governors, and but we do, as a state, the CDC can provide guidance, but we as a state get to make the decisions. It's one of the beautiful things about us, and we'll continue to make decisions which are best for the state of North Dakota here in North Dakota. I think that brings us to the end. Always been great, as always, the live audience, the online audience, everybody that's here, and of those of you that have tuned in, thank you for all of your attention and time. Thanks for doing everything to help keep North Dakota moving forward. And as I said earlier, and likely Bryan too, if there's Bryan or Michelle could be available afterwards here for offline questions or clarity if need be. But thank you all for being here. That ends today's conference.